Patrick and Grasha.
And my name is Dr. Ady Levelway. Today we are coming to you from Sport and Spine Rehab in Rockville, Maryland. We wanted to go over a couple partner assisted soft tissue techniques for when you have a little bit of tension in that upper back and shoulder area.
So basically the prompt to making these videos is one day I was working on my girlfriend's shoulders and after spending a good amount of time releasing those muscles, I asked her to work on me and it was pretty atrocious. So I decided to teach her some really basic versions of some of the techniques that we use in the office. And within a few short minutes, she was pretty successful at releasing some tight muscles. So we figured that it would be great to show our patients or anyone else interested in learning these techniques to just do a little bit of maintenance work at home. So let's go ahead and get started. I'm going to have Amy turn around for me. The first thing that we're going to work on is a muscle called the upper traps. Really commonly tight, annoying muscle. The upper traps that we're going to work on here will basically start from the top of the skull, okay, and it's going to traverse downwards to the end of the shoulder here, and then we're going to kind of draw a line from here to the spine. Now this little triangle is kind of the area that we're going to work on pushing, okay? So all these techniques that we're doing today are basically a pin and stretch technique. That's going to involve basically shortening the muscle. We're going to pin it down, and then we're going to stretch it and allow some of the fibers to kind of release as some tissues move and some don't. Now it's going to require a little bit of movement from her and a special hand contact from me. So the movement I'm going to teach her first, and then I'll go over the hand contact. Let's go over the movement. So the movement that we're going to do, again, we're going to go from here to here, so we're going to try to shorten that area. First, we're going to bring the arm up there like this, okay? And then the ear, right ear, is going to come to the right shoulder, like so. That's the starting contact, okay? What I'm going to ask her to do is to take her right thumb, and you're going to bring it down to the opposite side, kind of like you're putting on your seatbelt, okay? After she completes that motion, then I'm going to ask her to bring her left ear to her left shoulder, like so. Okay, so that's kind of like the stretch portion. The pinning portion that I'm going to teach you here, it requires a little bit of hand contact, and you can kind of relax. What I'm going to do is I'm going to create a lot of tension in this muscle. I want to avoid a lot of compression, okay? I don't want to get too pokey. So the fibers are going to run this way. I want my thumb to provide tension in the opposite way. So to do that, basically what we're going to do is we're going to have our hands just like this, and I'm going to force my fingers one way and my thumb the other. So it looks kind of like this. Okay? So I'm going to take a little bit of a squeeze. Also, it's important to note that my webbing of my thumb should be in contact with her shoulder. The hand should be nice and flat against it. So again, I'm going to make contact and give a little bit of a squeeze. Thumb is going to go one way, hands the other, and so I'm ending like this. Okay, just like that. I should have a lot of tissue underneath my thumb. The shirt is going to help me kind of display the way that I'm kind of pushing her tissue, but I really want to do a nice skin contact for this. Okay, so again, this is my contact. I'm going to come down in, thumb one way, and this way. Okay, so just kind of like that. Now we're going to kind of combine both of these things. So I'm going to have her go up into that starting position. Ideally, when you do this, we're standing directly behind the person using the other hand to reinforce. But for the purposes of this video, I'm just going to show you like this. So again, I'm going to get in here. I'm going to have my thumb go this way, my fingers go the other way. I'm going to have her reach out the opposite pocket and maintain my contact here. I will go with her. Okay. Once she completes that motion, her head will drop to the other side. Okay. And you should feel some nice tension where my thumb is. You should feel any pain or anything like that. So let's go ahead and just do two passes back to back here, and that's what you want to do. You want to kind of go the whole length of the muscle. So go ahead, reach down, good, and head to the opposite side. Excellent. So you're going to reset, and contact, good, head to the opposite. Okay. And that is how to kind of release these muscles. Again, it's important to note that these techniques should not be used on anyone with pain, weakness, numbness, and tingling to the extremity of the back, anything like this. Those are considered medical conditions that should be checked out by a medical provider. So, I hope you learned a little bit on how to release some of these muscles. Our next video is going to go over the levator scapula. I'm also deep to this in the shoulder. So, click subscribe, and I'll see you in the next video. Thanks.